morning. This is Tex. This is Tex Talks. Hope y'all are having an awesome day. Today's talk is probably a little bit of a pep talk as much as it is a discussion of things you can do to get better or things to help you understand mental health problems and conditions. Today, I want to start off with saying I know there's a lot of people out there who are desperately seeking a therapist, and I understand that. You're seeking medication, you're seeking things to help you, and the waiting lists are really long, and I understand that. In the area that I'm at here in Maryland, I have lots of people tell me there's a waiting list as long as 3 months. I know that they also make appointments in every organization that does medication management 2 months, 3 months out. There are some places that will see you sooner, and those organizations and places are trying hard to help speed up the process by having walk-in services. But again, we run into the problem of walk-in services that get inundated with too many people to be seen during the walk-in times, and then even those get delayed, put off, and it takes a while to get in, takes a while. Then after your initial intake, which is when you go in and actually sit down and tell them what you got going on, before you actually get to see a therapist and talk to somebody. And then again, also wait for medication management. So please do not give up. I tell people that I do talk to out in the world that are saying, well, I called and they didn't call me back. I understand and I feel your pain. I also know, though, that being a therapist, that therapists and other people get just inundated with phone calls, and we're trying our best to call people back, to put people on waiting lists, to set up things to help them. I will say, in defense of some of the therapists, they've gotten in over their head with waiting lists because managing a waiting list is almost a job in and of itself. Trying to keep people up to date, call people. And the catch is the more time we spend working a waiting list and doing that, the less time we spend doing therapy. You know, if you take just an average therapist who does around 40 hours a week, every hour that is spent doing anything other than therapy is taking away from the time people could have therapy, but it has to be done. You have paperwork, you have to manage your time, you have to put things in and call people and do things, return phone calls, you have to do paperwork, things that clients need from other organizations. They need a letter from us, they need some kind of paperwork. So as we do those things and we make that happen, it delays the whole process of then calling back people who are waiting for therapy, and the list just keeps getting pushed back and back. I also encourage you to please call people back a second time or a third time. Do not assume, please, that just because someone didn't call you back, that they don't want to provide services or they don't have space. A lot of times in the jumble of trying to call everybody back, sometimes a number gets misput and you think you gave them your phone number, but you actually ended up giving them a number off, or even through their own human error. They call the wrong number and then they don't get in contact with you. Or heaven forbid, they call you back and you have a phone message system this system is full or this box isn't set up, and then they can't reach you and the connection gets lost in the jumble. So I encourage you, please call them back. My analogy for that is if you were hungry and you went out to eat and you went to your favorite restaurant, for some reason they were closed for the night, would you just shut down and sit in the parking lot and stare at the door? No. You would find out when they're going to open. You would go to another restaurant. You would find some other way to get what you want, but you wouldn't quit until you got something to eat because you're hungry. And mental health is much the same way. You're going to have to call back, go somewhere, talk to other people. I encourage you to talk to your friends and coworkers if they know that you're struggling. Some of them may volunteer that they also see a therapist, or their kid sees a therapist, or their cousin Bob sees a therapist. And that also lets you know a little bit about the therapist that they're going to, because maybe they can say, this person's really nice. They work really well with kids. Word of mouth is a big way to get things around about, what kind of therapist this is, what kind of services. I also tell you to take everything with a grain of salt. Again, research, look, take what they say, go online, look, and then figure out what kind of therapist you want. And then keep calling and calling other places. Please do not just stop and say, well, I called and no one called me back, so I give up. Please do not give up. Keep working it. Okay. Also, while you're waiting to see a therapist, there are lots of things you can be doing that will help speed up the process for you when you see a therapist in healing. Finding out all the information that you can, reading books that you can on it, seeing what you can get free online. There are also other services that meet, depending on your need, that you may be able to get into sooner while you're waiting for a therapist. If you have any problems with substance or alcohol use, there are organizations and places from AA to NA, other groups meeting, church groups meeting, wherever you can get a little bit of help while you're in the process. If it's a grieving process, there are a lot of places that sponsor grief groups. And that's one way to get services in a small way until you can actually connect with a therapist. The other thing is there are books out there. There are workbooks for depression and anxiety. I encourage you, if you can get them, get them. If you can get them from the library and photocopy the pages you need out of them. These days, electronic services in libraries are tremendous. You can get lots and lots of things from the library for free, to include audiobooks electronically. You don't have to actually tote the book around. I know a lot of people who actually read books on their telephone. Bless them. If you can look on your little bitty phone and see that, you got way better eyes than I do. But I encourage you to do everything you can. And if you're watching this video, you already know, I encourage you to do things beyond what you would think is normal, just mental health, to include getting out, going for walks, getting exercise, getting your diet a little healthier, okay, getting a little better sleep when you can, and honing in on those things that may be causing you more stress. If sleep is a problem, then actually researching, what can I do for better sleep, and what will help me feel better, and feeling better may help reduce your anxiety a little bit. It may reduce your depression a little bit, and it keeps you going until you finally can get in and see somebody. So again, the message is, please do not give up. Please do not assume that people are not going to call you back because they don't want to, or they're being mean or rude. They may well be, but they also may just be overloaded. So please, please keep working on it. And I encourage you, get the help you need and get better. I hope you have an awesome day, and I'll talk to you later. Thank you.